Um, he said that once we get constructive with our behavior, that our feelings will follow. So that if we can kind of focus a little bit on some of these things, then we'll be able to kind of to move forward, and our feelings will follow suit. But if we are not constructive, that we will kind of fall back into this cycle, and our relationships will not change. Obviously, there's an emphasis on choice and responsibility. We are rejecting the ideas of transference. We say, be who you are. Don't avoid it. Practice with your therapist. Be real. Again, reality therapy. Be real. So just tell them how you feel. Throw it out there. This isn't kind of soft and squishy, like person-centered. We're not sitting back and trying to be like silent observers about particular things. We're being real, and we're going to tell them how we feel as counselors. We are trying to keep, once again, obviously the therapy in the present. We are not victims of our past unless we choose to be. Again, emphasizing that choice. This is interesting that he said that people want to avoid the present. Oftentimes it's a lot more comfortable because they have had the time with it to live in the past and kind of dictate your life from a past experience. Kind of roll out of bed every day from the same old bed with the ideas of that's who I am and that's where I'm coming from, rather than kind of looking at things as a fresh new day. He said that we need to kind of shake that off and realize that, hey, whatever happened in the past is in the past, and you can recreate yourself right now to help build some of those positive relationships. We looked at, he wants us to look at certain people who are part of our quality world. Oftentimes he'll do exercises where we draw maps and we try to decide who we want in our world, who our quality relationships are. And then also relationships that are disturbing us. Perhaps there's someone that we feel obligated to talk to every day, or that we get suckered into talking to every day, that really aren't part of our quality world and really are not helping us with some of those 5 genetic needs that we talked about earlier. And we want to eliminate those people, to be honest with you. We want to remove them from our life if they're not causing us some sort of pleasure or advancing us in some way. And again, sometimes it takes these kind of exercises for people to realize these things. It's not always so obvious. We avoid a focus on the symptoms. Oftentimes our behaviors are the symptoms of our feelings. And we don't want to use them as an excuse. Because you're depressed doesn't mean that you shouldn't work on your life. Because you're grieving doesn't mean that it's not time to also look forward. We don't like to use them as excuses. So we're not very soft there as reality therapists. We like to kind of call people out that kind of say, hey, you're using those things as a crutch. I don't want to hear it. Let's move on. Let's be solution focused and go forward from here. Symptoms can be a warning, though, that we are not behaving properly. Obviously, if you were depressed, you realize something is wrong, well, maybe there's certain behaviors that we can do to kind of correct that. But again, it's behaviors that we're emphasizing, not necessarily just the emotion or the cognitive aspect of things. He would challenge the view of mental illness. He's not a fan of the DSM-4 and all the labeling, all the categorizing, and all the boxing in. We kind of ask ourselves, kind of, what message are you really sending by putting someone in one of these boxes? Our goals to reality therapy are to get people connected, getting people connected to that quality world that we refer to, helping them choose who they want in the future, and the healthy relationships, and having them kind of strive and shoot for that. And we need to learn better ways to fulfill our needs. Okay, so those 5 genetic needs that we talked about, maybe we're filling them halfway, but maybe there's certain behaviors that we can do that will help us kind of fulfill them better. The relationship with your client, the therapist-client relationship, is essential. and you can't really teach unless there's a strong relationship. If not, then you got to refer out once again. You know, say, hey, this isn't really working. I'm trying to be real with you. I'm trying to challenge you, and you're being a little resistant. I think that you know, you'll need to find somebody else. Oftentimes it kind of starts with a couple questions. Question number one being like, hey, what do you want from therapy? You know, I'm a reality therapist. Is this the right fit for us? Obviously, we're talking about relationships, so you'd want to find out early on what their relationships are like, what they're looking for, and also what they expect from the relationship between you and them as a client. You know, what do you think that this is going to be? What do you think our interaction is going to be? How are you going to feel when I challenge you? How are you going to feel when I call you out? And just so that they're really aware of the process and the kind of person that you're going to be. We're trying to raise a self-evaluation. We're trying to determine where, what do you call it, whether or not their behaviors are fulfilling those genetic needs. And hopefully people can then do this internal process by themselves, where they're constantly evaluating themselves and saying, you know what, hey, I'm not having enough fun today, or I'm lacking in my love or my power and achievement today. What behaviors am I doing? What's working? What's not working? The idea is to kind of instill with them this self-test so that they can look at this themselves. And hopefully one day not need you as a therapist so that they can do these things independently. We're trying to teach them these skills of evaluating. The idea is basically to change our own behaviors and to do them in a way that helps those 5 genetic needs. And the method is to be real and to call people out and to kind of shake them up a little bit. And, you know, again, this is not a soft therapy. This is one that, you know, requires a bluntness and a cruel to be kind approach sometimes. So I don't know about you guys, but I think that there's times in my life when you almost need to hear some of these things, even if they're not nice things. It kind of helps, especially if the nice things aren't working. Once we realize that, hey, maybe, you know, being coddled for a little while doesn't do us best. Something along the lines of reality therapy could come in handy. So once again, reality therapy isn't all that different. There's no huge new concepts here. It's a little bit taking from Gestalt. It's taking a little bit from existentialism. It's obviously taking a lot from cognitive behavioral and behavioral approach. It actually is a splinter of the cognitive behavioral approach, but it's a little bit more specific and a little bit more directed, and it is what it is. So this concludes the reality therapy session. I'm next going to be talking about feminism, and I will see you on the feminism video.